Good morning and welcome back to the Politico Healthcare Summit. I'm Helen Collis. I am a health reporter for Politico, and this next session will be discussing how to ensure that innovation in Europe meets the healthcare needs. Europe is a leading centre globally for biomedical innovation, and it's one of the world's largest exporters of finished medicines and vaccines. But it risks losing this leading position as countries like China and Korea inch up the ranks in issuing intellectual property rights for promising drug candidates. This session will explore how Europe can maintain its position among the top innovators in medicine and in vaccines, but importantly, ensuring that it's developing the treatments that are most in need. Before we start, a few housekeeping rules. I encourage you to ask questions via swap card. If you're on a desktop, you can ask questions at the bottom right, and if you're on your mobile, it's just below the live stream. And if you're tweeting about the event today, please use the hashtag #PoliticoHealthcare. We have an excellent panel today to discuss how to incentivize the right innovation in Europe. First of all, joining me online, we have Ellen Hoen, Director of Medicines Law and Policy. Ellen is an expert in medicines policy and intellectual property law, and she has previously worked with Health Action International and Médecins Sans Frontières. Good morning, Ellen.
Good morning.
We have Arjon Van Hemgel, Deputy Head of Unit at Health Innovations at the European Commission's Research and Innovation Directorate. The People Directorate works towards developing a health, safe and more equal, fair society. Good morning, Arjon.
Good morning.
And joining me on the stage, we have Tilly Metz, MEP for the Greens and European Free Alliance group. Tilly is a member of the European Parliament's Committee on Environment, Public Health and Food Safety, and is also a substitute member on the Special Committee on Beating Cancer. Good morning, Tilly.
Good morning. Good morning, everybody.
So, I'd like to start by looking at Europe's existing incentive system for medical innovation. This system is currently under the spotlight with the European pharmaceutical strategy and could potentially see some significant changes proposed next year. There are currently market exclusivity incentives for companies to develop treatments for rare diseases and for children, as well as incentives for new formulations of existing treatments, for example. Ellen, I'd like to come to you first. This sounds like a wise approach for stimulating innovation in areas where it's most needed. Can you set the scene for us a bit here and tell us, has this system delivered the results?
Thank you. First of all, thank you very much for inviting me to take part in this panel. And I wish I could be with you in Brussels, but that's for the next time. When we talk about the European incentive mechanism, I think it's important to recognize that it is one of the most generous ones on the planet. But it's also important to realize that it is largely based on assumptions, and it is very firmly rooted in granting exclusive marketing rights and creating monopolies, left and right. And the assumption is that by giving these monopoly rights and giving these market exclusivities to pharmaceutical companies, that they will be incentivized to develop new products. Now, that may work to a certain extent, but we also have to recognize that there are huge unmet needs. And it is time to examine these assumptions. If you look, for example, at the orphan drug perks, which comes with a 10-year market exclusivity as an incentive to develop medicines for the treatment of rare diseases, of which there are about 6,000, that has led to an increase of registered orphan drugs from 8 to 169 in about 20 years, but it leaves still huge areas unmet. What you also see is sort of a gaming of the system, slight abuse, in some cases serious abuse of the orphan drug regulation, where old medicines become orphan drugs and overnight unaffordable for health systems. So I could give a lot more details, but the short of this is it's time to review these mechanisms and to test these assumptions, and for Europe to ask itself the questions: the money that we spend on innovation through this market exclusivity system, so through paying high prices, Are there perhaps better ways of spending that money directly on innovation? Because I'm not against spending money on innovation, but we should question whether doing it through paying the high monopoly price is the best way forward.
Thank you, Ellen. Tilly, I'd like to bring you in here. What's your take on this? We've heard that it's one of the most generous incentive systems in the world. We've got a huge increase in orphan drugs over the last 20 years thanks to this incentive system, but there appears to be some abuse. What do you think is needed? Should it have a big overhaul or should we finely tune it?
Yeah, first of all, I think we need more transparency and also accountability. If we give an exclusivity for 10 years to some companies for that orphan drug, there needs then to be a proof that indeed they need these 10 years in order to have their investment covered. If they have already all their investment covered after 5 years, no need to have an exclusivity during 10 years on one medication. So what we need is more accountability and also more transparency. And especially if we also put public money in the development of a drug. So we cannot, as elected, tolerate that at the end of the day, the consumer pays twice. Once with the public money that we put in it, and then again with a very high price then on the drug. That is not, that we cannot tolerate anymore. So we need more transparency on how long is effectively needed to cover all the investment of development, of research. And also there we need more transparency. Where exactly did the money go regarding the development of a new drug? And then for me, once we have developed a new drug, we have to guarantee that it's indeed accessible also. So that's another, that it's affordable and accessible. And of course, we need to go on investing and working together, public-private partnership. Of course, innovation needs that. But right now, to be honest, I have the feeling there is an imbalance towards the private sector, who is much more setting the agenda, is also taking the leading role in the governance of all those developments. So that's no good. So we need a better governance, really, also from public authorities, a better cooperation, and really what Helen van Toorn said, really tackling the unmet needs, and really also analyzing what is really the societal impact. And so that's our things we need to tackle much more.
Fantastic. Thank you, Tilly. Lots to dig into there. Before I come to you, Arjon, I just want to get your response to that, Ellen, specifically on proving the that over the 10-year period that the investment has been paid back or has been covered by this market exclusivity. Do you think that's a model that would work?
Well, I think that is a very important point. We have argued for a sufficiency principle, because today it is just, if you do orphan drug, you get 10 years. If you get a patent, it's 20 years. It can be extended with 5 years with a supplementary protection certificate, and all of that is justified with the notion that that is important. Otherwise, you would not have these innovations. But that is not tested. If you would have a sufficiency principle, you could examine how much of this, when is it enough? How much of these exclusive rights, how much of this market exclusivity is necessary to recoup the investment? If you look, for example, at the orphan drug regulation, it's very interesting. There are two routes to obtain an orphan drug designation. One is by simply showing that you have developed a product for patients that represent 5 out of 10,000 population. That is an assumption that will be a medicine that is not profitable. But that is not really tested. There is a second route, that is the return on investment route, the regulation provides for, where you show that the product that you are developing will not be profitable without extra help. Now, that route is actually only been used once in the 20 years and has subsequently been withdrawn. But actually, that should be the norm, that you show that indeed it isn't it isn't profitable and you need extra assistance. And with all the other incentives, we need to have a sufficiency principle and say, let's make sure that these incentives are better tailored to what is actually needed, and that these incentives indeed incentivize what is needed from a public health point of view, because you want to steer these innovation perks towards there where the greatest health needs are. And that is also not working in the current system.
Thank you. Arjon, I'd love to bring you in now. Obviously, you're our representative from the Commission here. The Commission has been carrying out an extensive process of listening to stakeholders throughout the healthcare sector, including the industry itself, as well as getting public feedback. How close are you to the plans that are being drawn up? We're waiting for proposals now. Are we likely to see some fine-tuning, or are we going to see quite a big overhaul of this incentive system?
Well, I think that COVID-19 and the pandemic that we are in now has shown us that we need to rebalance the incentives. And really, as the previous speaker already said, you have to make that in agreement with the public health needs. And that's, of course, the most important part here. So what we are doing from DG Research and Innovation is, of course, supporting research, going from the early ideas, but taking into account that what is being developed there as novel tools and technologies has a good chance to be taken up and to be of benefit for the patients and for society as a whole. So for that reason, of course, we need to get the balance right and put the incentives in the right place. So that means that we have to use a different array of incentives that we have available to support research and also to work in partnership with all the stakeholders on the side of the public health needs and the healthcare system, but also the academics that come up with the novel ideas and the novel technologies, and include there, of course, collaboration with the industry to have this support from end to end and to develop the compounds and the solutions that we need. So in the current pandemic, we have seen that there are things that we can use, so to be faster also and to be more targeted on the needs. So for instance, we had a possibility to come out with urgent calls for research on COVID-19 already in January last year. Then we also had a possibility to work together with partners like the European Investment Bank to provide financing to CureVac and BioNTech to develop their vaccines, which of now, of course, especially the BioNTech vaccine, has made a big impact, of course, in the life of everybody right now. So it's really important to take these incentives into account, to look also at where the market works and where the market does not work, and to work with stakeholders. And I think that the private industry is an important stakeholder there. So we have partnerships where we're working with member states, and there we're working, for instance, on transforming healthcare systems to make them more resilient, to work together with the member states, because you want to take these public health needs into account. So what is needed? Provide the research and the incentives to go in a direction that you really address the economic aspects of the society and the health needs of our patients. And together with that, of course, we're also working with the private industry, because as you already mentioned in your introduction, the industry is important in Europe. We are in a leading position and we do not want to lose that position. So for that reason, it's extremely important. But what was also mentioned is that if we are supporting the development of these novel technologies, you also have to make sure that they're accessible and affordable. And for that reason, under Horizon Europe, our new framework program for research, that is really something that has been put in now into the regulation. So also, of course, by talking with NGOs and other stakeholders, it's very clear, of course, that this point has to be strengthened, that we have to take care that we're developing the products that are needed, but that they're accessible and affordable with fair prices.
Thank you. Ellen, I'd like to bring you back in here to talk about the COVID example. Is this something that we could push forwards and use in other areas, or should it just be reserved for emergencies?
I think there are a number of key lessons that can be learned. I mean, what struck me was that no one said at the onset of the pandemic, oh, well, we have this very generous pharmaceutical and vaccine incentive mechanism. We just sit back and wait and see what it delivers. No, the public sector really took a leading role in financing the development, as the previous speaker also said, in financing the development of the vaccines, which are still the most important key countermeasure in this pandemic, and that has led to tremendous success. Within months after COVID was declared a global health emergency, vaccines came to market. That has never happened this rapidly. And of course, the financing that became available, about 90 billion last year alone, was absolutely key in that. But an important lesson also is that while those billions were spent, the opportunity to make sure that these vaccines and the knowledge required to produce these vaccines would become global public goods, as was promised by the European Commission. That did not happen. That financing should have come with better strings attached, not only in the interest of the public at large in the European Union, but also to fulfill the European Union's responsibility vis-à-vis the rest of the world. Because the situation we are in now, that where we're talking about booster injections in high-income countries, while in Africa, 2% of the population has only received the first shot, is absolutely unacceptable. It is, from a moral point of view, but also from a public health point of view, very unwise, because no one is safe until we are all safe. That could have been avoided. The World Health Organization fairly early on in May last year established the COVID-19 Technology Access Pool, and that knowledge, the intellectual property, the manufacturing know-how could have been driven towards that pool if the European Union, for example, in its agreements with the pharmaceutical industry, had made that a condition. And that has not happened. And I think that that is a very important lesson for the future. That is also a very important lesson for the new mechanisms that are now being created for pandemic innovation, such as the plans to establish HERA in the European Union, that would really have to be sorted out ahead of time, because trying to regulate that in the midst of a health emergency has proven to be impossible. It did not happen. So we need to make sure that that is better taken on for the future. The lesson for other innovation is if you want to steer innovation, if you want to prioritize certain unmet health needs, spend the money on it. Spend the money on it directly. I'm a great proponent of financing innovation directly, with the conditions that then indeed the pricing would have to be fair, and also that knowledge is shared globally with those countries that need it. Over.
Thank you. Tilly, I'd love to get your response to some of these points, particularly that the public sector took a leading role and this led to a real success, but it was perhaps a big opportunity missed, that it didn't have more strings attached, more conditionalities to make sure that those vaccines and that know-how really was equitably shared around the globe. Do you think this is an important lesson to learn, and what can we, we're also talking about more funding going into the sector. Is there enough money to do that from from Europe's institutions, and what do you think about these proposals?
First of all, let me say that I really love to listen to Ellen van Troon. She speaks me right from the heart with the proposal, so totally agreeing what was been said before. But of course, I say, and I recognize that the fact that we have these vaccines now regarding the COVID pandemic, that is also because we work together there, the 27 countries, that the Commission made this advance purchase agreement. So it's a success story. If there would not have been this public money invested in and working together at the beginning with 6 different pharmaceutical industries, we would not have had the vaccine so quickly. But then there comes my but. And I'm very sad that so far I don't really see that we made the lesson learned out of that. I completely agree that the Commission is not used to this public-private partnership and also having to make these contracts with this pharmaceutical big companies. So that and there was an emergency and there was a lot of pressure. So I do have totally understanding for that. But on the other hand, it's important to now make the lesson learned and to come to another kind of contracts where it is very clearly that is linked to conditions. It is not possible that right now we have for certain donations that should be made, the companies must be asked for if these donations, they allow these donations. We all agree, unfortunately, even if there at the beginning the idea of COVAX was a very good idea. But today what we see, it is a failure. At the beginning, we should have 2 billion at the end of the year be given to low and middle income countries. Where are we now? I think 400 million. And then they turned it out to 1.3 billion till the end of the year. But 400 million versus 1.3, and as Ellen van Toon said very rightly, nobody is safe until everybody is safe. So even if you don't do it by altruism, then do it for you. But it's not working. It's becoming kind of charity. And then we have the system that does not work. And then we have the problem with intellectual property rights. If we put public money in something, there should be stronger strings, as you say, conditions very clearly, and also accountability. And it cannot be that we still keep up, and that's a call to the Commission, to this intellectual property rights, which really blocks. We know that in other countries like India, Indonesia, they could work also on vaccines, but now with still keeping up as Europe, as the Commission, with this intellectual property rights, I think that's also a lesson to be learned for the future to fight pandemics, that we really make a waiver for pandemics on the intellectual property rights. So, and then regarding HERA, I could say a lot on HERA too, because there, for the moment, the European Parliament should have an important scrutiny rule. Is there loophole is kept out of there because it's. For now, it's not seen as an independent agency. So it's very important that public money, even if there is this, I don't want to go too much into the detail now, if they take an Article 122 to say, no, it's only about funding. No, it's not about only funding. We're speaking here about public health and guaranteeing, we need to also there guarantee transparency, and we need also, I come back to the issue of transparency also regarding the contracts. If they now allow that some MEPs of the Parliament have access to the whole contracts that have been made and that are going to be made with pharmaceutical companies, but afterwards they are not allowed to speak about it. So, no, come on, it's about common interest that we're speaking here, and there should be full interest, and there were public money invested there. There should be, sorry to repeat myself, transparency on the coast, and there should. We have really to make a paradigm shift and stop putting, when we talk about public health, trade and trade secrecies and big companies or beneficiary or only where only a few are profiting financially. Here we're speaking about public health, and Ellen mentioned it. It should be done where it's common money, public money put in, then it's also a common good. And that's what we should keep in mind when we are in a phase of a pandemic and we speak about citizens' health.
Thank you. Arjon, I'd love to get some of your responses to this, specifically the European model in the pandemic and vaccinations and funding and then buying in advance these vaccines that were in development. What's your take on expanding this model to more medicines in need? Is there a willingness in the Commission to expand it to other areas? And I'm thinking of particularly difficult to reach areas for innovation like antibiotics, for example.
Yeah, thank you for that question. I think it's very important, of course, excuse me, to learn the lessons and to see what we can improve upon, and also the new opportunities that are provided. So you mentioned new antibiotics, new antimicrobials, and we know that that's an area of high public health need. We see that there's more and more resistance against the antimicrobials and antibiotics that we're using at the moment. And that means that certain patients are more and more difficult to cure because we're losing the effectiveness of these very important drugs. Now, the problem there is that while we want to have these new antibiotics, new antimicrobials on the market, it is not an attractive area to work in because here, when they come to the market, they will be held in reserve and only used at the last moment when nothing else works. And that means that there is only very limited amount of sales, and that means that it's actually not attractive for developers to go into this area. So this creates a problem. We have the technical problem that it gets more and more difficult to find new compounds that are active against and safe, of course, safe for humans, but killing the microbes. So this is difficult to find, but then the financial problem is a major hurdle here. So of course we can learn elements from what's happening now in COVID-19 with the advanced purchase agreement. So where we are actually trying to buy something that is not there yet. And I think that is the thing that we have to learn here, because here also with the new antibiotics, we want to have something that is not there yet. So what we are looking at now is trying to find new incentive models that would allow us to support actually the development of late-stage development of antibiotics, but then also with a procurement element attached to that. So normally this is difficult because if you are supporting research with public money and then also limit the market to say, okay, I'm also going to buy from that party that I already supported with the research, then you're excluding the others and you're disturbing competition. Now here in the area of antimicrobials, we have a non-functional market. So there is no competition. And that means that there's European legislation under, for instance, an innovation partnership is a part of European legislation that allows you to combine these two elements. So to combine support for late-stage research with procurement. And what we are working on now is working together with the member states to develop possibilities to go in that direction, so that actually what we are doing is not only support the development of these antimicrobials by grants and trying to let's say, push the new compounds in the pipeline of development, but also look at the end of the pipeline and make it attractive for developers to bring something to the market and especially to the patients, of course. So here, indeed, we're thinking about novel incentives and trying to learn the lessons that we get from the COVID pandemic.
Thank you. And Ellen, I'd love to get your response to this. Is AMR and antibiotics particularly unique, or can we apply this model to more diseases and treatments to provide, advanced purchase agreements and extra public funding?
Well, antibiotic drug development or the failure of the drug development is a very clear example of a problem where which you have to solve outside of the commercial sector. You cannot expect a commercial company to invest a lot of money to develop a product which they then subsequently are asked to keep as long as possible on the shelf, because the business model is to get a new drug out as quickly as possible to as many people as possible and make as much money as possible in the early years of a new product. And with antibiotics, you want to have the exact opposite happen. So I wouldn't be at all against to pull that completely out of the commercial sector and actually finance the competition in the innovation part. So create the market for the innovation and not focus so much on the sales. And it sounds a bit like that is the plan of the European Commission. Clearly, this is also something that needs to be tackled at the international level, because once new antibiotics are developed, the cautious use of them, the stewardship of these products will need to be handled also beyond the European Union, because you want to be able to keep these products as effective treatments as long as possible. But that needs to go hand in hand in ensuring that people in in less wealthy countries also get access to these products. And I think that should always be part of the responsibility of the European Union when you invest in innovation, that you also do it in such a way that people in low and middle income countries gain access to them. Another example of an area which has sort of been pulled out of the commercial sector, and that doesn't mean that there isn't collaboration with the commercial sector, is the so-called neglected diseases. The neglected diseases, they're often tropical diseases or parasitic diseases that mainly affect people in very low income countries. There are no commercial incentives to develop those products. There are non-for-profit drug development initiatives. The Drugs for Neglected Diseases is an example of that has successfully brought new chemical entities to market at fairly limited costs. So those are very interesting models, possibly also for other diseases. Again, when we look at the rare diseases in Europe, I would say, why not finance the development of the treatments for those rare diseases directly? Do not rely on the market prospects, but rely on the fact that there are a lot of people out there who love to develop new treatments and who love to develop new medicines, but they need the resources to do so. So give the resources directly.
I'm conscious of time now. We've just got a little over a minute left, but Tilly, I'd love to get your response to this. You know, financing these neglected diseases. Is there willingness in Parliament to put up more funds for these things? How are people more willing now, having seen the examples in COVID?
Yeah, what we would need that in the first step maybe is a better coordination and also then a better supervision done by public authorities. And then in the next step, of course, I'm dreaming of more European public research center and development centers, but already having more independent scientific advisory board would be important, and really analyzing also the added therapeutic value for the patients, because that is often neglected. We are speaking about the antibiotics, the 11 antibiotics that came on the market since 2017. Only 2 of them were really novel class antibiotics, so really bringing an added value. I could say the same regarding the cancer drugs. Those developed, Emma made their analysis, those developed in the last year, only a very low percentage did really bring added value, life quality to the patients, and also benefits on the survival. So that is something we need to tackle. Also regarding innovation, putting on the market, and then doing also post-market studies, where often the data is lacking or the design of the collecting of the data is not pertinent, because we need really to put the patient in the middle and not economic market reflections.
Thank you. We've reached the end of our time today. Perfect timing, Tilly. Thank you. I think we've had a great discussion today on the problems with the current incentive system and some of the really interesting solutions that have been put forward, especially off the back of the pandemic examples. Thank you very much to our panelists, Tilly, Ellen, and Arjon, for joining us today. Please remain seated. Up next, we have Sarah Wheaton, Chief Policy Correspondent, who is interviewing Margarita Schinas, Vice President for Promoting a European Way of Life at the European Commission. And then after that, we will have a 15-minute break. Thank you.
Thank you.